Hello everyone, and welcome to another episode of Ask Dr. Bob, and I must say, some of the best questions yet. First question, Dr. Bob, what type of food and beverages can I eat or drink to boost the blood in my body? Well, let me put it to you like this. You want to avoid foods that have estrogen in them that compromise liver function. So if this was a female, when you have high estrogen, you're going to have a heavy menses. Now, if you happen to be a male and you want to increase your blood, what you're going to want to do is stay away from gluten, and that would be for the females also. This is a really an interesting and very important point. I have had anemic patients that consume gluten we learned that via their diet sheet. Take them off the gluten. See, the gluten clogs your body's ability to absorb minerals, and within 120 days we see improvement. We also will assist with nutrients for that, including often a liquid iron. It was an excellent question, by the way. Good afternoon, Dr. Bob. Your ADHD book helped me tremendously and changed my family's life. But I'd like to ask you, what are your thoughts on IUDs and a vasectomy? Thank you. Well, I can tell you, taking a birth control pill is not really a good idea. I had a vasectomy myself back in 1987, and I've never had any complications. I think if I was someone, instead of taking and using an IUD, you may consider having your tubes tied or having the clips. I think anytime you place an instrument inside of your body as a female, I think it can cause altered physiology. I'm going to be 60 years old, and I haven't really had any challenges with the vasectomy. Just an FYI. Dr. Bob, what do you do with extremely high testosterone? Now, if you are a female and have extremely high testosterone, it could be that you have cysts on your ovaries. You need iodine. If you're a male and have high testosterone, that's okay. But if I was a man and I had low testosterone and started doing the testosterone patch, you need an aromatase inhibitor, commonly called chrysin, C-H-R-Y-S-I-N, and or eat broccoli. Ladies, high testosterone, possible cyst on your ovary, you may consider a urine iodine loading test. Dr. Bob, how long can I get relief with chronic neck pain? I'm going to tell you this. I see it all the time. Get off of sugar. Sugar causes chronic left neck pain. Pineapple, white potatoes, yogurt, raisins, anything sweet that aggravates the pancreas will create left neck and mid-back pain. I am telling you, I learned this back in the 1980s, probably the most significant thing I've ever learned. Dr. Bob, do you have any information on how to reduce a nodule on the thyroid? Well, what I would do is I'd have a TSH, a T3, and a T4. I'll say that again. A TSH, T3, and a T4, and a TPO. I'd get off of gluten, but you're going to want to supplement your body accordingly. Iodine, you probably live or need iodine. She was going to say I could learn to live without the drug, so it's usually an iodine. Last question for ulcerative colitis, Crohn's, and which probiotic is best. Now, what I have found, there's something called Phytolin, POA, that we use in our practice. Phytolin, POA, Paul, Old Apple, POA. How much gluten are you consuming? Do you have parasites? Oftentimes I see a gluten sensitivity, a dairy sensitivity, and a fructose sensitivity. As I am speaking to you right now, we're going to be having a practice member come in for a report of the findings that has a very enlarged liver. And the same pattern that we saw recently for another individual had a fructose challenge. So you may consider getting off of fruit sugar, which also can bother your colon. I would watch this video over and over again. This is probably some of the most intriguing questions. Thank you once again for asking your questions. We are here to make a passionate difference in your life. Bye.